Exactly. That's why I said minimal. That's the minimum and the maximum. That's my hard line. Max.
Hello, good afternoon, everybody. We're just waiting a few more minutes for a couple of more folks to join. Thank you.
Oh, here we are. Renee, it's 12%. Oh, they get scary, yeah.
Okay, we're going to go ahead and get started. Our host is had something to come up, so he may join us soon. But I'm Connie Farakhan, and just want to welcome everybody to our program today. And I would like to just get an idea. Oh, and my colleague is Charlene Jackson. There she is now. See, am I sharing myself? Yes. Okay. So um, we are here trying to give you a little bit of information before the holidays just to help us all out. And also, um, based on some things that have happened over the last few years, we will be giving some tips on how you may advocate for yourself in healthcare. And so, with that, we're going to go ahead and move forward.
In the sky.
Can everyone see the screen yet?
Yes, I can see it. Thank you.
Okay, just one moment. Okay, again, we want to thank you all who have joined. And today we're going to talk a little bit about advocating for yourself in healthcare. And would you all just kind of introduce yourselves to say, so we can know, please? Anybody can start. Can you hear me?
Hello, everybody. My name is Armando Rojo. I work as a customer service representative. I work with the administration and employee engagement department program.
Okay, great. Thank you for being here.
Thank you for the invite.
Good afternoon. My name is Deandra, and I'm a part of KC Health IQ. Um, and yeah, that's it.
Okay, thank you. Anyone else on? Charlene, I'm going to ask if you could just see who else is on. I can't see it right now.
Mhm. It's only one other person.
Okay, Miss Jackson, are you there?
Miss
Yes.
Linda.
Can you hear me?
Yes, we
Yeah.
can now.
Okay. My name is Linda Jackson, and I work for Nurse Family Partnership.
Okay, great. And I don't know if we have anyone else, but we're running a few minutes behind. So anyone else who kind of logs in or joins us, can you just put your name and in the chat? Thank you. So today we're going to walk through um, basically who we are, who our program is, and what we do, how we're funded, and we're going to talk a little bit about health literacy and why it's important and provide a few tips. And then we'll jump into self-advocacy. And finally, we'll wrap up with a summary of some steps, and then sure, a short video that shows you how you might talk to your doctor to help you as an advocate. And for anyone who's in the building, shall I say, or nearby, we do have some in-house tools that we can share with you. And although our focus today is on self-advocacy, we wanted everybody to know how important it is for us to know about health literacy and what that's about. And so we're going to start with that because we need a lot of changes in our systems and our organizations across communities and across medical providers so that there's improvement in communicating so that people can have better health and life outcomes. And for anybody who's interested, um, there's health literacy webinars and videos on our KC Health Department's YouTube page. And the link for that is on in the resources that you'll see at the end of today's discussion. So I'm going to turn it over to Ms. Charlene to kind of walk through a few slides. Want to take it away, Charlene?
Okay. Hello, everyone. I'm Charlene Jackson. And as stated before, we are KC Health IQ. KC Health IQ is a program created to address health disparities and health literacy during the COVID-19 pandemic. KC Health IQ operates under two federal grants, one being the Office of Minority Health funded which funds the health literacy project. The health literacy primary target populations are African descent and Asian descent. The Center of Disease Control and Prevention funds the Health Inequities Project, and the Health Inequities target population are Hispanic and Latinx descendants, along with lower social economic status individuals. Many social determinants make certain populations more vulnerable, such as your income, where you live, and unfortunately, other things such as race. Some historical factors also influence how people think, such as the Tuskegee event. And kind of, you can go to the next slide. Um, project goals are to address health inequities through providing health literate health education to community members, organizations, healthcare, and healthcare practitioners, fostering public health networks in the community, building and empowering community capacities through training and educational opportunities, and promoting resiliency, sharing education and resources for health concerns such as COVID 19 vaccine hesitancy, chronic disease, mental health, and etc. Over the grant period, staff responded to provide additional requests from communities as as relevant to staying healthy and being able to move forward in life, especially during the COVID-19 pandemic. You can go to the next slide. Okay. What is health literacy? Personal health literacy is the degree in which individuals have the ability to find, understand, and use information and services to inform health related decisions and actions for themselves and others. Organizational health literacy is the degree in which organizations equitably enable individuals to find, understand, and use information and services to inform health related decisions and actions for themselves and others. We can go to the next slide, Connie. Okay. What does health literacy look like? It looks like making decisions about health, such as getting vaccinated, a community health worker teaching parents about vaccine schedules, recognizing symptoms and knowing when and where to get tested, and a non English speaking patient calling to schedule a COVID-19 test. Has anyone ever had medical appointments and came and came out unclear about what they were supposed to do next, or feeling like the appointment did not help you? If if you wanted to share any of that information, you can unmute yourself, or you can also put that in the chat.
So one of the things that we would like to do is hear from you in the audience whenever you feel like there's something you'd like to speak on. So Charlene just kind of asked a couple of questions, and we want to know, have you had any experiences at a doctor's office um, where you think you should have done something differently? Or do you have anything coming up where maybe after walking through these tips and training, you may consider doing or saying something different? Anyone want to comment? If not, we can move on.
Okay. Um, Tips for writing clear health information. Make your audience and purpose clear. Make your content easy to navigate. Use clear words and sentences. Give specific action steps. Use clear design and make numbers clear and give them meaning. What we are really talking about is using plain language that you might use every day. A link a link to additional information is in the references for health literacy training and videos. So that'll be provided to you at the end. And you can go to the next slide, Connie.
Okay. And I do want to just mention quickly that those trainings, I'm sorry, not the trainings, but the videos are in um, 7 to 12 languages, especially the pediatric videos. And they're all relevant to vaccine hesitancy and other health concerns that we've had over the last couple of years. Sorry, Charlene.
The good news. By using health literate communication tools, people have the chance to understand complex information and enable themselves to make good decisions for their health, no matter their level of health literacy. We need literacy in order to engage with the written word in everyday life. Think of how often you use your own reading skills in everyday life. It's not just words like on the page that require literacy, but signs, labels, and the messages on your phone too. Literacy plays a vital role in transforming people into socially engaged citizens. Being able to read and write means being able to keep up with current events, communicate effectively, and understand the issues that are shaping our world. And so, next, we'll be talking about health advocacy, and Connie will take that over.
Okay, thank you, Charlene. And literacy is even more important when it comes to your health. Um, and that's why we're talking again about health literacy. So, what is self-advocacy exactly? Well, it's what it sounds like. It's the practice of vouching for yourself. It's the ability to communicate your needs. And why do you think self-advocacy is important? Anybody want to mention or talk about why they think that's so important?
I think that this is very important because at least you need to communicate and you have to explain in your best knowledge, in your best way, what kind of issues are you having at that moment that you want to share with someone with more knowledge.
Exactly. Thank you. Anybody else?
I think self advocacy lets the medical professional know that you are serious about your health and
Hmm.
that you the information that you bring or questions you ask um really means something to you, and so they should take you seriously when you're there.
Hmm. Okay. Thank you. So, what we've learned is people who self-advocate are more likely to thrive in school, work, and in life in general. So, self-advocacy skills can be learned at any age. So, again, why is this self-advocacy in healthcare so important? Well, it's because it's your ability to represent yourself when managing your care in the healthcare system, which all of you know is very complicated. And effective healthcare actions usually differ for each person. So, being a self advocate helps ensure that your healthcare is tailored to your individual needs and reflects your goals, values, and preferences. So, becoming a self advocate for your health can really be beneficial or helpful to your health outcomes. So, being a self advocate also means asking for help when you need it. So, for example, if you need help in understanding anything your doctor is telling you, ask for it to be explained in a different way, or if they have more information about it. Don't leave without clearly understanding your role in your care. Self advocacy has three basic elements: understanding your needs, knowing what kind of support might help you, and communicating and telling what your needs are to other people. And again, we mentioned that everyone has different needs, so it's important to learn about yourself and to talk with others when you need assistance. So, again, self advocacy, it's important to get the most out of your medical appointments. It's critical to learn how to effectively communicate and advocate for yourself because your doctor is the healthcare expert. You are the expert about yourself. So it's important that you work to gain the knowledge and information and tools necessary to actively partner with your doctor. This can help make sure you make successful treatment decisions together. And don't forget to learn your patient rights. We have a link to that in the resources also. And remember, only you know what your concerns are and the questions you need answered. So again, you must actively work or do the research to learn the information needed to partner with your doctor. Pay attention to your body so you can clearly describe what you are troubled by. And if you're not really sure, it's important to talk with others who may be able to help guide you. Maybe a counselor, a teacher, a friend, or even your healthcare provider. Because again, you are your best self advocate and you must be able to take a lead for your health. When preparing for a healthcare appointment, for example, keep some special notes. You can use your phone or a notebook or anything that you prefer, but keep a special note of your health information and any special medical documents. Have a special location for it so you always know how to find it when you need it. And update this information regularly. You also want to think about letting someone else know where the information is in case they need to get it for you. And then right before your appointment, write down some notes about why you are seeing the doctor. If you're seeing the doctor for a special complaint, think about how and when it started, what makes it worse or better, and your symptoms, like your pain, if you're nauseous or whatever, and also what you might have tried to make to feel better. Did you take some aspirins or Tylenol? Your medical documents or notebooks that you keep your information in could include things like a list of your allergies, your allergic reactions to certain medications, your routine medications, special tests, etc., that you would like to document. And right now, we'd like to know, is there anyone who would like to share a situation where you've been in or wish you had been more of a self advocate? Um, or do you have an appointment coming up where you plan to be more of a self advocate in the future? I can say one example where a few years ago where I scheduled an appointment with a local eye doctor close to work, just because they were close. And when I went into the office, I started to ask questions, and the doctor just kind of patted me on the head and said, "Don't worry about it. I'll just take care of everything." And so I was kind of insulted. One of the other things that we can share later is information about class standards, and that's considering cultural, being more culturally appropriate and linguistically appropriate about what we're doing and how we're communicating. And so I didn't go back to that doctor, needless to say, because I was insulted that they were not interested in what I had to say. Anyone else would like to comment on that? Okay. So here's the 5 steps to advocate for yourself when talking to your doctor. They're real quick and easy. Make a list of your questions ahead of time. Be specific and include details. Explain your concerns when you schedule your appointment because otherwise they may not schedule enough time for you. And build in time to arrive at your appointment. Build a good relationship with your doctor. You want to get the most out of your doctor's visit. So in addition to listing your questions ahead of time, do some more homework before your medical visit to be more informed about your health concern as well as what your doctor tells you. Be specific, include details, and describe your symptoms. And talk about any medications, tests you may have had. Try to know about your family history. The more the doctor understands, the better they can assist you. So being prepared ahead can help you explain and not forget anything that is important. Also, be on time or arrive a little early. This can be seen as being respectful, and it also may allow more time for you to review what you want to talk about with the doctor. If you do not agree with or don't understand what the doctor says, ask questions. You could also ask about other options. Even after your visit, after you read through all your information and you still have questions, call, ask more questions because we are part of our own care. So that's kind of our show for today. But next, we're going to watch a short video um, just to give you an idea of how to talk to your doctor. Although I'm sure many of you have some ideas on your own. But this is a special video that we created just to kind of give people some ideas. So I'm going to share that video real quick. Well, before I go to that, I'm going to just share the resources that we have. And anyone who would like a copy of this presentation after this afternoon, just email me at Connie, CONNIE .FARAKHAN @kcmo.org, and I will be happy to send you a copy of this presentation. So, anybody have any real quick questions before we move to the video? Okay, well, we thank you for joining us, and I'm going to sign out of this presentation, and then we'll go to the short video. It's about a minute long. Can everyone see and hear that?
We can see it, but we can't hear it.
Okay, I'm going to stop sharing for a moment so we can turn the sound up.
Doctor's visits have always been a challenge. The time with a doctor goes by so fast, it's hard to understand everything they're saying, and afterwards, I can't remember it all. I don't always feel like I can tell them everything, and sometimes I don't know how to explain what I'm feeling. My body is changing, and I'm taking more medicines, and it's really overwhelming. Last time I came here, I tried something new that my friend mentioned to me. I brought a list of questions I had, and I also wrote down everything I could about my symptoms. I wanted the doctor to know how I was feeling. That way, maybe I would be able to talk and not forget anything. And you know what? It went great. I felt like I was finally taking care of myself. And my doctor wasn't surprised. They appreciated that I was prepared for our visit. They just asked me more questions about how I felt and how long my symptoms lasted. And they really liked that I had a list written out. They encouraged me to take notes from our appointment as well, but not just copying what they said. For example, they wanted me to write down the new health instructions how I could understand them after asking them questions. I told them that I may not understand what I wrote down later, and they said if that happened, I could contact them at any time to make sure I understood what I need to do and how to take my medicine. They also told me that the nurses and my pharmacist will be able to answer questions I have as well. Now I feel more connected and involved with my health, and it makes me feel so much better.
Okay, so that's all we have for today. Would anyone like to have any discussion or follow-up? Brian, hello. Brian is our host for all these holiday presents that we're trying to give you today and this week. Anybody have any questions or comments?
I'm gonna take the
And if you don't want to unmute, you can feel free to put it in the chat. We are looking at that to see if anything comes across. As people are thinking, I do want to thank Charlene and Connie for that presentation. It's very informative and greatly appreciated. And I hope that each one of you has taken something good from it. Still waiting to see if anything comes across. We're still open for questions, comments, things like that. Before we wrap up, I do want to share real quick just a little bit of information. Can you all see the screen?
I think it's coming. I don't see it yet myself.
Okay. And how about now?
I
No?
can see it.
Okay.
There you go.
Okay, perfect. There we go. Sorry, computer's been a little bit slow working on its own time. So this is for today. We do want to let you know that tomorrow we will have at the same time from 2 to 3. We'll be here for day 2 of our 4 days of health miss. I'll be presenting on understanding our mental health. And the last thing that we are wanted you to take a look at is if you have a second, go ahead and break out those phones. We have a short survey that we like each one of you to participate in, just to give us a little bit of feedback. If you can't scan that QR code that is on the screen, I did post the link to that same survey. It is short. It won't take you more than a minute or two to complete. But we just wanted to get your honest feedback so that we can better present. But not only that, we can also get an idea of topics and things like that that may interest you, um, that we can potentially present on in the future moving forward. So feel free to click the link that's in the chat or to go ahead and scan that QR code that is on the screen. All right. So with that being said, I'm gonna turn it back over to Connie or Connie and Charlene for any last comments before we head out.
Hi, this is Connie, everybody. I just want to thank you all for joining us. And again, if you have any questions or want a copy of the presentation, you can email me at connie.f like in Frank, ARAKHAN at kcmo.org. And we appreciate you joining us today. I hope you have a wonderful holiday. Thank you.
Thank you, Connie. Charlene, anything from you? You're muted.
No, I didn't
Okay.
have any. No, I didn't have anything. Thank you. Oh, thank you for everyone that joined, and yeah, have a nice holiday.
Thank you. I've also put Connie's email in the chat for you all. So again, if you haven't or if you have already signed up, tomorrow we'll be back here at 2 to 3 for day 2. You can also use this exact same Teams link to join for tomorrow's meeting. Without any other questions, we thank you all and we appreciate you and we will see you tomorrow.
Like it was literally. Bye. Thank you.